Hello, my name is Mike Potter, and I am the developer of the FluFIT program. I work as a professor in the Department of Family and Community Medicine at the University of California, San Francisco, and direct the San Francisco Bay Area Collaborative Research Network, which is a practice-based research network which reaches community health centers across Northern California. I'm really happy to have the opportunity to talk to you about our program, but first I just want to give a bit of an overview about why to use fecal immunochemical testing, what are the characteristics of a high-quality FIT program. And then I'll talk about the FluFIT program, which is really just one form of quality improvement program that can help kickstart your efforts in community health centers to higher screening rates, and give some examples of how it's been implemented and some resources for you in case you decide that you would like to try this program in your settings. So FIT, fecal immunochemical testing, it does have its advantages. We all know that colonoscopy is the most commonly used screening test for colorectal cancer in the United States, but we also know that we'll never get to 80% screening rates, especially in community health centers where colonoscopy access is limited, without an emphasis on stool testing. FIT is inexpensive, it's easily obtainable, it can be offered by any member of your healthcare team, meaning you do not need to have it offered by a physician. It can be offered by a medical assistant or even a member of your clerical staff. It can be done by the patient in privacy at home, often using a single stool specimen without any special preparation. It's compared to other types of stool tests. You can often give it to the patient with the instruction, please take this home and do it tonight and mail it back to us tomorrow. It's very easy in that way. It's non-invasive, and it has no risk of pain, bleeding, bowel perforation, or other adverse outcomes that can come with colonoscopy. Many patients appreciate that. And for those who are reluctant to get a colonoscopy, you can tell them, well, if you do the FIT test, you only have to do the colonoscopy if the FIT is abnormal. And if you have limited resources to offer colonoscopy, you can also reserve those resources for those who need it the most. If it's done yearly and followed up correctly when it's abnormal, it's actually similarly effective in terms of colorectal cancer morbidity prevention to colonoscopy. And then finally, it just bears emphasizing that many patients prefer it. And this is especially true in patient populations where there may be less trust in the medical setting, where they may be reluctant to, they may not understand prevention, they may not want to take time off from work, they may just simply want a non-invasive test. So many patients do prefer it, and that's really important to remember. It is a first-class test for colorectal cancer screening, and we can offer it alongside colonoscopy and be very proud to do so because it will reduce colorectal cancer morbidity and mortality if we use it that way. So doing more FIT is especially important in public health settings, as I already alluded to, and this is some data from 2014 screening rates in community health centers. You can see that across the country, screening rates are low. California is doing a little better than most. At this point, they were 4.9% screening in community health centers. Still not that great. There is some good news in that screening rates have been increasing nationally. So now the national rate is 38.3% in FQHCs on the UDS reporting system. And in California, I believe it's gone now over 40%. I think it's about 42% as of 2015. So, so that all sounds great. FIT tests can be offered enthusiastically by your clinics. And it sounds easy to do. It's just a simple thing you give to patients, but it is it is actually a little bit more complex than that. First of all, there are many brands of FIT. You have to pick one that is known to be effective, and there are some resources available to help you select one that is evidence-based. Just because it's FDA approved does not necessarily mean it's been rigorously tested in clinical practice. So that's important to select an important immunochemical test. Then once you've picked the test you're going to use, then you have to find the patients. So you have to identify your eligible patients. And you can do that when people come in to the office opportunistically, which requires having access to information about prior testing at the point of care. Or you can create a registry and do outreach. It takes a fair bit of work in most systems to get that data. You really need an electronic health record and ability to create reports and point of care reminders. So you have the test, you have the patients, then you have to get it to the patients. And one important thing is training the staff to communicate appropriately. Colon cancer screenings is unpleasant to some people, or it sounds unpleasant, and some staff may be squeamish about recommending a test that involves handling your stool. And it's really important for them to understand both how potently effective colorectal cancer screening with FIT can be, and to be enthusiastic about how it's actually much easier than it sounds. So once those messages have gone out, then you also have to make sure that the patients understand how to use the test. Most of these tests are fairly easy to use, but the written instructions provided by the manufacturers are often not written at a low literacy level, or they may not be available in languages that patients can read. So it may be important for you to take a look at those instructions and adapt them so that your lower literacy patients or non-English speaking patients can use them. Once you've given the test to the patients, you still have to assure that the test is completed when provided. This usually means telephone follow-up for those who have not completed the kits within a couple weeks, or postcards. Those types of interventions can really be helpful to get your screening rates in many cases. And then the test has to be processed appropriately. And when possible, if you can have a test that is mailed directly to the laboratory rather than to your clinic, you probably have a better chance of having high-quality test processing. And that's because a lot of times they can be processed by machine in the laboratory or by staff that are dedicated to doing this, as opposed to whoever in the clinic happens to be free and able to develop it. It may not have the proper training. So it's also important then to make sure that you get the test results, and if you have abnormal test results, you still have to get a colonoscopy, and that's often requires a fair bit of effort and navigation to get them in, especially if you're in a setting with limited appointment availability, or if it requires a significant amount of transportation or patients to get off work when they don't have any sick leave. So that requires quite a bit of staff outreach to make sure that those 5% of people who will have an abnormal FIT will make their way to colonoscopy. And then, of course, you have to let people know with the normal test results know that they have had a normal test, but that's not enough, that they're going to have to repeat annual testing. And then with all your patients, you have to keep this up, because a test that requires yearly completion needs to be an ongoing process. That's where all the work comes in. And this is true for any FIT program. So before you ask about, well, what should I do about colorectal cancer screening, and should we have a FIT program of any kind, you do have to ask yourself, how important is colorectal cancer screening within my organization? Who's going to lead the effort? What resources are we able and willing to commit? It is going to take some extra staff, some extra time. It is going to be a long process and a sustained process. Can we leverage and learn from other activities that we already do well? And I'll mention that sort of is the little kernel that spawned the that grew into the FluFIT program, the idea of, for example, a flu shot program that you have that works really well, can you leverage it to jumpstart your colorectal cancer screening? Are there other activities, other mailings or outreach systems that you have that you're already using that you can leverage for colorectal cancer screening if you're not doing it already? And then how can we make it easy for patients? And that's the thing about reaching them in several ways. When they come into the clinic, when they're not in the clinic, for primary care or for other reasons. And making it easy for patients may mean something like even mailed reminder, paid postage for the kits to be mailed back to the clinic, for example, rather than asking them to bring them in person, which many clinics do. And then how can we make it easy for the clinicians and staff? So is there a way to streamline systems? How can you integrate these things into workflows so that it doesn't feel like a lot of extra work, even though we know it is? And then once you do something that's successful, how are you going to sustain it? And how can you, if you start with a small pilot, how can you expand it to reach ever more patients? Maybe you're piloting in one clinic, but will you be able to do it in all of your clinics if you're a large community health center, for example? So it's definitely important to plan for success and think about the big picture before you start. So why FluFIT? As I mentioned, it's a really simple idea, really, of using the time of flu shots to offer FIT. It can be implemented as part of a flu shot activities that are organized in most community health centers every year. It creates an opportunity, if you haven't really emphasized the importance of colorectal cancer screening, it creates an opportunity for the whole clinic, from clerical staff to nursing staff to clinicians, to gear up for a time-limited campaign, just sort of like you do for a flu shot campaign. So everyone gets educated about the importance and all the procedures and how to give it and how to explain things to patients in a time-focused way, and that really can help not just make the FluFIT program a success, but it can help boost your other efforts that your clinic is doing year-round. The nice thing about this program is also that these point-of-care interventions like this are actually very inexpensive and probably less expensive, say, than mailed programs where you mail out hundreds of kits to patients and hope they return them. Those programs can be very successful too, but if you have a population that's not used to being offered stool testing, mailed kits may not work that well. It might require a little bit of in-person touch to explain things. And again, it's something that doesn't require building a whole new infrastructure to implement. So it can be done with limited resources, and it can be sustainable without a lot of outside help. We have hundreds of clinics across the country have done this with just using our web-based materials, and many have had some success with it. It is adaptable for many different types of clinical settings. So, for example, if you have a flu shot clinic where people are just coming in to get flu shots, you can give FIT kits then, or you can integrate it within your primary care visits. It has been offered in other settings besides community health centers, such as managed care settings, and even there's been some groups in pharmacies trying to do this. And then finally, it is evidence-based, and it does work. And it gives people the message that just like a flu shot, I need to get colon cancer screening every year. So here's a flow diagram, and I'm not going to go through it because I really have already gone through these different components. I was talking about what a good flu shot, a FIT program should look like in the different components. This just breaks that out with regard to the FluFIT program. And this diagram, a version of this diagram, is actually on our website, and you'll have a chance to go and visit it later. So again, where to do FluFIT programs? These are just some places where we have tried it in our research. The first picture is at St. Francisco General Hospital's Family Health Center, which is a residency-based program where they have a large flu shot clinic every year for their primary care patients. The cluster of clinics on the upper right are community health centers in San Francisco that are run by the city and county of San Francisco, and those clinics have chosen to integrate FluFIT within primary care during flu shot season. We have also done this at Kaiser Permanente, where they have large flu shot clinics every year, and we've done some pilot work in Walgreens pharmacies with this as well. In theory, you can do FluFIT programs anywhere people get flu shots. This is a line at Kaiser Permanente that this was actually before we implemented the FluFIT program at Kaiser. And when I saw this line, I was just thinking, look at all these people sitting around. They don't know it yet, but they're just sitting around waiting for a colorectal cancer screening test. So, it was a great opportunity. Eventually, we worked with them and developed this FluFIT assembly line so that the patient who comes through to register for the flu shot at that time, at the point of care, these staff members who are not nurses are actually just looking in the electronic record to see whether or not the patient is due for colorectal cancer screening. And if they are, they're handing them a FIT kit. And so the woman in the middle, you can see, is handing a patient who's due for colorectal cancer a FIT kit before she gets her flu shot, while she's waiting in line, and is able to do so in about a 30-second time period, and with or less. And patient information is inserted inside about why to do it and how to do it in multiple languages and low literacy versions. And with instructions to them, if they have additional questions, they can certainly call or contact their primary care doctor. So this is just one of the ways that Kaiser has added this on as another layer to help them with their very impressive efforts to improve colorectal cancer screening, which involves mailing, which involves very heavy emphasis during primary care visits. They see this as a way to boost their colorectal cancer screening rates by a few percent every year at the end of the season when they are being evaluated on how well they do. And Kaiser now, their screening rates in some of their facilities is approaching 90%, if you can believe it. And this is one of the programs that they use to incrementally improve their screening rates. So you can see that even in a setting where colorectal cancer screening is already very prevalent, a FluFIT program can add, and it's seen as something of value. And they did spread it to, Kaiser has multiple locations, and the Kaiser endorsed this program for all of their clinics. We developed an internal website for them. They actually have these annual training programs for their flu shot coordinators, and they include now FIT training with those flu shot clinic programs, so that it's something everyone knows about. But then they leave the management of it up to the local teams. So some teams feel it's, in some clinics where they're already doing extremely well, they have used the time of flu shot actually for other things, like to offer mammogram referrals or even make referrals for PAP tests, believe it or not, or to get people up to date with other immunizations simultaneously. But many of these sites are still offering FIT, and they really are looking at the time of the flu shot as a time for comprehensive prevention, and very gratifying to see how the FluFIT program helped jumpstart that process, even for Kaiser, which is already doing a fabulous job with preventive health services. So the basic FIT algorithm that I think is worth everyone to remember, that it's very simple for staff, to use, to know who needs FIT testing. Basically, if they're between 50 and 75. And have neither had a colonoscopy in the last 10 years nor a FIT in the last year, nearly the vast majority of those people should be offered a FIT, can be offered a FIT test. Now, some people have been concerned about, but what if the patient has a high risk of history of colon cancer, or a high risk of of colon cancer or they're bleeding, you can certainly add those questions to the algorithm. But in a population health setting where your screening rates may be extremely low, many clinics have had the philosophy of, well, the primary care doctor should be asking those additional screening tests and should be assessing those risk factors and offering colonoscopy to those people already. This is a way just to catch people up and offer them FIT if they have not been screened by any other method at this point. So there are many ways to adapt this FIT algorithm according to your local needs, but the two most important questions are very simple ones that you can see you don't need a lot of medical training to ask about or to look for in the medical record. And then these are just some examples of materials. These are on our website that we've developed some messages with patient input that encourage people to get screening in the FluFIT program. And it's really pairing the flu is preventable with colon cancer is also preventable, which is something many people don't know. That they're easy, they can save your life. The recommendation, the strong recommendation by everyone in the clinic is certainly important. And then having it in different languages seems to be important. Putting up posies is something that we use as a poster. We're using as a poster in the clinic. At one point, you can see it says 50 to 79. That's what we were recommending back before the U.S. Preventive Services Task Force narrative to 75 as the upper age limit. But you can see multiple languages, something colorful. These types of small media can also encourage interest and help people to get screened. And then this is for the PolyMedCo kit. This is just an example of a wordless instructions that you can give to patients. There are actually videos on our website that show people how to do it in multiple languages. So there are many resources you can use to help educate people about colorectal cancer screening in low literacy populations, and I encourage you to pay attention and try to adopt them because it will increase your return rates. So again, don't forget about cost, because it does cost something to put on this program, and people do ask about it. I'm sure none of you have ever have a. I'm sure most of you rarely have the opportunity to forget about costs. I think, you know, the costs are somewhat influenced by the extent to which you can bill for the FIT kits and the rates at which they're being reimbursed locally. A lot of clinics have negotiated with some of the FIT kit producers so that they don't have to pay for the kits that are mailed out. They just pay for the developer. And that way you don't have to worry quite so much about kits that don't get returned in terms of the cost. But really, these kits, FIT kits, can be obtained for less than $10, including the cost of the developer per developed kit. In most cases, they can be billed for double that if they have insurance. In most cases, so and for something that we really want our patients to do that has such a high return, it really is something that most community health centers should be finding a way to invest in. The staffing does cost some money, of course, because when spending time on FluFIT means less time on something else. But again, these are two of the most important preventive services that your clinic can provide. And of course, the follow-up colonoscopy can be expensive, especially if you're offering it to those who have no insurance. Many communities have volunteer resources that they can access for these situations. Of course, if you already know that you're not going to be able to offer a colonoscopy to a patient, if it turns out to have an abnormal FIT, if they happen to have an abnormal FIT test, then perhaps you shouldn't be moving forward with the screening program at that point. You do need to build your own local business case. I think most of you can easily do that. So here's a little bit of implementation resources. We do have a website. It's flufit.org. It says flufit.org, but it's really flufit.org. And there's sections on the website about why to do it, how to do it, some materials for your staff training, some program materials that are designed to be downloaded and edited and tailored for your setting, some frequently asked questions, a list of our publications, so in case you're wanting to dig into the evidence behind the intervention, and contact information in case you'd like to reach me. I'm often able to provide brief advice for your programs if it's something fairly straightforward, and certainly have occasionally done consultations for people who wanted more intensive help. So in summary, FluFIT programs, they're just one of many ways that you can kickstart and enhance your colorectal cancer screening programs in your primary care. And FluFIT programs reinforce that message that just like a flu shot, we need to offer FIT to our patients every year. And patients actually learn this message. I can tell you because I recall there was one patient. One of the doctors at Kaiser, in fact, told me, said, I was about to offer my patient a FIT kit because I knew they were going to be due in a couple months. And they said, oh, no, don't worry about that. I just get my FIT kit when I get my flu shot. I'll just pick it up at that. So these types of messages, just imagine if our patients were as motivated to get FIT kits completed as they were to get flu shots, we would have, in these community health center settings, we would really be doing somewhat better, much better on our efforts to get colorectal cancer screening rates up to our national goals. Again, lessons learned from doing a FluFIT program can be used to improve screening practices throughout your organization and can also be used for learning for quality improvement more generally. Keys to success are that deciding that screening is important, that's probably the most important, and engaging the whole clinic team, making it feasible, making it fun and creative, mapping out some effective processes, taking time to do that, and really thinking through those processes. Everyone makes mistakes. You know, flu shots are shot season is a short period of time, and it can be hard the first time to get it right. So that's okay. You can learn from your mistakes and try again next year. Every year it improves. If you can imagine, when clinics first started offering flu shots, it probably took most clinics several years to really get things down and get it right. So it's the same probably with a FluFIT program. Celebrate your small successes and don't give up. And we do have available resources. We have the FluFIT org website, which I encourage you to visit and download. Everything on there is free, freely accessible. You can advertise and share your stories on Facebook. We're experimenting with a Facebook page, and I often think that rather than hearing advice from me about a good FluFIT program, how to do it, it would be wonderful if community health centers would have a place to share their stories online so that others can learn from them. Again, you know, the American Cancer Society has been a huge booster of this program, and they have local primary care experts who are able and willing to advise your clinic on how to do this successfully. Feel free to contact them. They're there to help. And then finally, just more generally, I wanted to remind you about the National Colorectal Cancer Roundtables, helpful resources online. I'm the co-chair of the professional education and practice implementation for the Roundtable, and I am perpetually impressed by the level of excellence of the resources that have been developed by the Roundtable over many years for all kinds of clinical settings, and really just about any question you have about colorectal cancer screening, you can find it on that website. So please don't forget about that incredible resource. Closing, I just want to thank the collaborators on developing our FluFIT program. This includes funders and also promoters of our program. And I want to thank you for taking the time to learn about colorectal cancer screening and think about ways that you can make a difference for your patients and those that you serve. It is a really important mission.